Generalized Anxiety Disorder, GAD. This is when a person feels anxious most of the time, about almost everything: work, health, family, the future. Even when there's no obvious reason to worry. It's not just normal stress, it's persistent, uncontrollable worry that can interfere with daily life. People with GAD often feel on edge, have trouble sleeping, and struggle to concentrate. Panic disorder. Panic disorder is when someone has sudden, intense episodes of fear, called panic attacks. These can happen out of nowhere and feel like a heart attack, racing heart, shortness of breath, chest pain, dizziness, or a fear of dying. It's not just the attacks themselves, it's also the fear of having another one, which can lead people to avoid places or situations where they think it might happen. Social anxiety disorder. This isn't just being shy. Social anxiety is an intense fear of being judged, embarrassed, or humiliated in social or performance situations. It can make everyday things, like speaking in class, eating in front of others, or even making eye contact, feel overwhelming. People with social anxiety might avoid social situations altogether, which can affect their work, relationships, and self-esteem. Specific phobias. A phobia is an intense, irrational fear of a specific object or situation, like spiders, heights, flying, needles, or dogs. People with phobias will go out of their way to avoid the thing they fear, even if they know it's not dangerous. The fear isn't just discomfort. It's often a full-blown panic response. Agoraphobia. Often misunderstood, agoraphobia is the fear of being in places where escape might be hard or help might not be available if something goes wrong, like public transportation, crowded areas, or even leaving home. It often develops after panic attacks and can become so severe that a person may avoid going outside altogether. Separation anxiety disorder. While often seen in children, it can affect adults too. It's an intense fear of being separated from someone you're emotionally attached to, like a parent, partner, or child. People may worry something bad will happen if they're apart, and it can cause distress, clinginess, or even panic when separation is expected or occurs. Selective mutism. This is a rare but serious anxiety disorder mostly seen in children. A person who can speak normally in some situations becomes completely silent in others, like a child who talks freely at home but not at school. It's not about defiance or being rude. It's an anxiety response that makes it feel impossible to speak. Each of these disorders is real, valid, and treatable. Anxiety is one of the most common mental health struggles, but understanding it is the first step to healing. Remember, you are not alone.